Hello everybody, I'm Dr. Prabakar. Happy Monday and welcome to the TheFibroidDoc. Today I'm going to do something a little bit different. I decided to do a Facebook Live instead of my usual YouTube episode. And this segment is titled Don't Bleed to Death. Okay, don't bleed to death. And I'm going to start with a personal story from my own life. So last year I had my third baby and things were going well. I was in the postpartum period. Typically the postpartum period is about six weeks. And after that things are healing up, you're doing well. And I was feeling great. And about 5 weeks I went on a long walk with my friend, and when I got home that evening around 5 or 6, I started bleeding. A lot. Okay, so I was like, this can't be happening. I've been doing so well. Why am I bleeding so much? And so I kept like bleeding and bleeding. I could barely keep up with changing pads. I was starting to get a little nervous. Now, I don't have fibroids, by the way, but the amount that I was bleeding was exactly like what my patients tell me. And I started getting a little nervous, and I yelled out to my husband down the hallway and said, we need to go to the ER now. I probably at that point had bled about 1 liter, and the human body has about 5 liters of blood. Okay, so I knew I was getting a little woozy, and I remember I think I was like in my pajamas. I just put a towel around my waist and I got in the car, and like off we went to the ER. Luckily I live close by. 5-10 minutes, I went to the ER and I, told them like, hey, this is what's happening. I need blood. When you're an obstetrician and this happens to you, you're already thinking of all the worst case scenarios. Oh my goodness, I probably need a blood transfusion. Okay, after that, if that doesn't work, I need this. And if that doesn't work, I need something else. And so my mind was already like going crazy. But I went there. Typically, they draw your blood and they look at what your blood type is. A positive, O minus, whatever, and then they match blood to give it to you. And I said, don't even wait for that. Just give me O negative blood. Okay, O negative is the universal donor. So regardless of your blood type, you can receive O negative blood. So I got into a room. They started giving me the blood. I looked at the monitors, and they were beeping, and my blood pressure was like 80/40. Okay, normal blood pressure is 120/80. So my blood pressure was super low. My heart rate was very high, and I remember looking up at the ER doctor and saying like, don't let me die. I have 3 kids at home. And I was extremely panicked to not know how this was going to end. Like, it was like a bloodbath in the ER bed. Finally, I saw the blood going in. I saw, fluids going in through my IVs. I started seeing my blood pressure go up a little bit. I started feeling, slightly better. Starting to get a little calm. Okay, I'm going to survive. I'm going to make it. And then I just, took a moment as I lay there, and I thought, my goodness, this is how my patients must feel when they bleed from fibroids. So many patients tell me this exact same story. Now, I wasn't bleeding from fibroids. I had a postpartum, hemorrhage, but it's the same thing. I mean, bleeding, like pouring blood, hemorrhaging blood, can't change pads, tampons, whatever fast enough, rushing to the ER, getting fluids, getting a blood transfusion. It was extremely scary. And, I'm a doctor, I'm a gynecologist, like this is the stuff I deal with all the time. And it was extremely, extremely scary to me. And I thought about all the patients who, told me the story like time after time in the office, as they bled from fibroids. Now, luckily, I was, 5-10 minutes away from a hospital. But imagine if you were on a plane, like flying from California to Hawaii, 5 hours over an ocean. Like, you're going to be in big trouble if this was happening to you right then. Or imagine if this was happening to you every single month during, your period. You're hemorrhaging like this, rushing to the ER. What kind of quality of life, are you having? So that's why title is Don't Bleed to Death. And I know I talk a lot about bleeding with fibroids, but despite having a lot of different effects, the bleeding is the biggest one because it can be the most life-threatening complication from fibroids. And there is a lot that you can do, and I'm going to get to that in just a bit. So that's number one. If you have fibroids and you're bleeding all the time, don't bleed to death, and take care of yourself and get some help. Okay. The second point is, it is not just the size that matters when it comes to fibroids. It is actually the location. Okay, and I'm thinking about the next several cases that I'm going to do in the operating room. And these are patients who came to me with bleeding stories exactly like what I described, what happened to me last year. And yet, when you look at their uterus and you look at their fibroids, they're extremely small. They have about 2 or 3 centimeter fibroids, a couple of marbles put together. So it's not very large, but the fibroids are inside the cavity. Okay, they're inside the uterine cavity where a baby would form, or where you bleed from every single month during your period. So because they're inside the cavity, they tend to bleed a lot. And these are the patients who are having these kinds of stories with hemorrhage and blood transfusions. And I think about another patient who I saw just last week. This patient, I did an ultrasound for some other reason, and she has this 9 centimeter fibroid. And I asked her, hey, do you have any symptoms and pain, pressure? No, nothing. And it was just in a location behind her uterus where she didn't really even feel it, and she was not having any symptoms. So there's a patient with a 9 centimeter fibroid who had no symptoms, and then the several patients then who have just a couple of 2 centimeter fibroids, but because of where they are much more symptomatic, and they need to get this taken care of. Okay, so that's a nugget. It's not the size that matters, it's actually the location. Okay, and the last point is help is available. If you listen to my last episode on last Monday, I talked about the fact that I had this patient who was going to Africa every summer to do mission work, and she couldn't change the fact that she was one in 26 million American women who has a fibroid. She can't change the fact she had it, she has it. What is she going to do about it? She was brave enough to take one little baby step and take a medication prior to her trip, and that just changed her life. She was able to perform so well on that trip and just really do what she went to do in Africa. And there are so many patients that I see in the office who are bouncing around, between ERs and various providers without a clear, diagnosis and or diagnosis or treatment plan. And there's so much out there. Do I take a hormone? Do I take a shot? Do I put in an IUD? Do I do some office procedure? Do I go to the operating room and do a big surgery, right? It's very confusing. There's a lot of different opinions and stories from friends of friends and Google stories and all of these things. But I really urge you to find a physician and, talk about your symptoms and, get informed, get to know about all the options out there, and just take one little step to help yourself live a more productive, beautiful life so you can actually, enjoy this time with your family, go on vacations. Speaking of vacations, that after that hemorrhage happened to me last October, I was actually supposed to go to Yosemite for Thanksgiving. And I planned this trip with my family, and if you haven't been to Yosemite, it's one of the most beautiful places on earth. It's in Northern California. It's a large park. And I was thinking, oh, well, if I feel better, should I go or not? And then, my colleagues quickly talked me out of it and made me realize, if this had happened when I was out in some park far away from a hospital, I could have potentially died. And so, it was not something to take lightly. So if you are suffering from fibroids, especially bleeding, don't take it lightly. Don't wait for this kind of incident to happen to you when you're on a plane or on vacation or in the middle of an important meeting or being there, with your kids. Be proactive and, do something about it. And if you're in California, from the Bay Area, I'd love to see you in my office in Oakland. If you are somewhere in California and you want to do a televisit or just virtual visit to learn more, I'm happy to do that. I'll put the information below. If you're not in California, there are plenty of fabulous gynecologists all around the country. I really urge you to seek one out and get this issue taken care of if you're suffering from fibroids. And please tag a friend or share this with a friend if you think somebody may benefit. Come to my YouTube channel, TheFibroidDoc, and subscribe. I'm putting out an episode every single Monday for you, and I would love to even hear about special topics that you want to hear about. Some of the things I'm working on are fibroids and pregnancy is one that is going to be a really cool month of episodes. I see patients with fibroids every day. I just finished an office day today and I saw at least 8 patients with fibroids, and this is really important work because I'm committed to really helping women feel their absolute best. So please subscribe, share, and I will see you next Monday. Take care. Bye.